I'd like to bring up some points I've learned recently about postpartum depression. Two studies that came out recently, one out of Wisconsin, one out of Pittsburgh, show that if you have an epidural injection during delivery, your chance of having postpartum depression is lower. It was an association. They didn't go as far as advocating epidural injections to avoid depression, but that study suggested consideration. And then the other study looked at mindfulness training compared to standard childbirth training. Mindfulness training is meditation and breathing techniques. And those individuals who took that all the way through the delivery process actually had less postpartum depression than others. It's very difficult to identify postpartum depression in the individual mother, so it's important for family members to look for signs of anxiety, excessive crying, excessive fatigue, a lack of bonding of the mother and the baby, changes in the interpersonal relationships of the mother and the family members. Those are important signs to look for, and especially if you start hearing things like thoughts of suicide or thoughts of death, it's very important for the family members to take that mother and seek help, get professional help. Time is often of the essence. It is important to identify and treat postpartum depression early because it is just more effective. Treatment of many diseases, and postpartum depression is a disease. It's not a character flaw. It's not an emotional weakness. It's not a weakness of the mind. It's a true disease. Identifying it, diagnosing it, and treating it promptly are critical for the health of the mother and the health of the baby. Thanks, Dr. Dave Campbell, bringing you this message today.